cause that your sleep is very inefficient. Up to 30% of the general population is obese. Obesity is actually the strongest risk factor of obstructive sleep apnea. Upper airway collapse during the sleep. The most interesting thing about it is... My name is Łukasz Mokros and I'm a psychiatrist and psychologist. I currently hold the position of acting head of the department of the stationary ward of Department of Neurosis, Personality and Eating Disorders here in Warsaw in the Institute of Psychiatry and Neurology. And I am also a scientist and I am associate professor in the second department of psychiatry, also here in Institute of Psychiatry and Neurology. I took part in a series of studies. It was based on a very big database of patients with obstructive sleep apnea. And we've devised a series of articles, research articles, which investigated how simple clinical data like BMI or neck size can help us better predict the risk of obstructive sleep apnea, because there's still a big problem in the public that the gold standard diagnostic procedures, so the polysomnography, availability still could be better than it is. So we actually need to be good to predict the actual risk and to decide which patients require polysomnography, who need first to introduce the treatment, because they may suffer from really severe obstructive sleep apnea. The BMI, so obesity, is actually the strongest predictor, strongest risk factor of obstructive sleep apnea, right? Because the whole point, the whole mechanism of sleep apnea is obstructive sleep apnea is that the upper airways, they collapse during the sleep because of the body position, because of the excessive tissue around the throat. And this collapse can cause either apnea or hypopnea, so a very shallow breathing, right? And if there are lots of those apneas at sleep, it actually may cause, it can rise your blood pressure. It can cause that your sleep is very inefficient. So the two main consequences are that you suffer from excessive sleepiness during a day, and if you drive, you can cause accidents. And the other thing is that it increases the risk of cardiovascular diseases, because physiologically our blood pressure falls when we sleep, and if you experience apneas, it actually stimulates the autonomic nervous system, the sympathetic branch of this system, which causes the blood pressure to rise, because it causes arousals, right? Because if you can't breathe, you experience a choking, right? You think you suffocate, and it is a stimuli for our fight or flight response. It actually, what we've confirmed is that if the patient is obese, so if the BMI is over 32, actually the risk is particularly high that the obstructive sleep apnea will be independent of the sleeping position, because it is more common that we catch the apneas when we're in our supine position, so we sleep on our back. For some persons, when the obstructive sleep apnea is not that serious, when they sleep on their side, they won't experience apneas. But if they are obese, their BMI is over 32, actually the risk of the position-independent sleep apnea dramatically increases, right? So in other words, when somebody has the BMI of less than 32, this patient can wait a little bit longer for their polysomnography, and they can be simply given an instruction to just sleep on their side, apart from the obvious instruction to lose weight, right? Because if a patient with sleep apnea loses weight, it is obviously linked with lesser amount of apneas, right? The risk is proportional to the body mass.
And now I have for you a question from my previous guest. What is the most interesting thing when it comes to studying the mind?
Talking to the patients, right? You actually, when you talk to the patient, you experience their mind. And it's actually the talking to the patients that are a source for ideas to the clinical studies, to the research. What is the most interesting thing about it is interesting findings. They just will never end.
What do you mean by experiencing their minds?
Every one of us have empathy, right? So we have this very unique ability to, let's call it, stepped into someone's shoes, right? To feel their emotion, to imagine what they are thinking, to imagine what they can imagine, right? It is actually one of the reasons why we can develop a social life, right? Why we can develop society. This process is called mentalization. So you imagine somebody else's state of mind, and to properly you can describe somebody's state of mind by mere listening to what the person says and how they behave, but you need to add this extra thing to that, right? So to imagine what they experience, right? Why do they feel it? Why are they in the position they are, right? So and it gets really interesting, but also you need to imagine the suffering that comes along the way. For example, to those who experience hallucinations, right? Or like auditory hallucinations, especially those which are, very scary for them, right? Yeah, so the approach to sleep apnea, the mainstream approach, is very mechanical, because it is about just, making sure that the air flows through the upper airways, right? So sleeping on the side just to prevent from collapsing, right? So much, what is also a gold standard introduced here in Poland to treat sleep apnea is using a special mask which increases the pressure in the airways at night. This therapy is called positive airway pressure, right? It can be either continuous, so constant pressure, or it can have two levels depending whether the patient inhales or exhales. But it's still not every patient goes with it, because it can be, it can actually induce anxiety, because you need to wear a mask all the time you sleep. And not all the patients cooperate with the mask very well. It is tough to, wear something all night.
I read about it that like 50% of people on this therapy quit. Yeah. This is crazy, unbelievable.
Yeah, that's right. One other, so because there is a small, relatively small proportion of the patients who actually are not obese, but they have problems regarding their sinuses, their anatomy of the upper airways, right? So those patients can benefit from proper procedures. It doesn't matter if we are obese, if we have specific anatomical structure of our upper airways. It forces us to have certain habits regarding how we breathe, how we sleep, and probably there is not enough emphasis given to some habits, to how we maybe there is too little of a focus on breathing technique, right? Because one other let's say mainstream appliance which is used to treat sleep apnea is a specific it's a specific mask which actually changes the position of the mandible, right? So this position, changing of this position, actually improves the condition of the upper airway, so it is easier to breathe, right? It's also using appliance. It is not comfortable for everyone. Not everybody tolerates it, but when we sleep, it is actually less to our voluntary actions, yes, how we breathe. But there is also some, I think it's not yet, we can't call it evidence, but some notion that, putting some effort to proper habits of breathing and also eating, right? We're talking about obesity. It can improve the way we breathe at night.
What is your opinion on mouth taping for a night? Because I do that. I tape my mouth shut for a night.
It may help. It may help. Because this is actually the simple thing, right? Many where actually I experienced this on myself and also among my patients that, well, you wake up in the morning and you feel like that your mouth are dry, right? And it is somehow you automatically have this feeling that you haven't slept very well, and it's usually true. Because the reason why the mouth is dry is because you slept with your mouth open. We already know that teaching somebody to breathe with their nose, it is a common fact, right? Breathing with your nose is actually more physiological because it provides a proper humidity to the air and the warmth to the air that we breathe. So it's this air that we breathe through our nose is, let's say, it's more healthy, right? But it also have been found that habitual breathing with your mouth can induce anxiety. It can be linked to some changes in how you chew, in how you your jaw develops, right? When it reaches the early stages of your development of your if it begins in early age, right? So maybe also forcing the breathing with your nose at night can help. But it's probably not a remedy to all, right? Because not everybody will feel comfortable. Maybe it needs some adaptation to this, but not everybody will tolerate it. But it's like with every other treatment, right? And of course it won't work if your nose will be congested, right? But does it work for you?
It does work for me, but of course first thing is to open the nose. And for that I use Buteyko method. I used to practice this for 6 months very regularly every day and quite intensive. And since then, actually after that period, I stopped practicing and I really don't have to do that anymore.
Because it's your habit now.
Now it became my habit. My body used to smaller amount of air, and well, my nose is probably still small as before, but a smaller amount of air is just enough to oxygenate myself.
Yeah, this is just such a common misconception, because we think that we need to breathe with our mouth when our nose is congested, but in fact, it's about adapting our breathing to the congested nose, and suddenly it's it's no more congested, right? But we need to learn to tolerate these first feeling that comes, because when you try to breathe with your congested nose, it actually can cause increase anxiety, right? Because you can't take enough air.
Exactly. And coming back to habits, is it possible that the bad habits compounded, they can be a cause of sleep apnea?
It is not a purely functional disorder,
but it is mechanical, right?
Yeah, it is mechanical, but it is a tough question. I don't know data about it. It is an interesting one, because it would be interesting to simply treat sleep apnea with just, improving your breathing habits, right? Maybe also there is some portion of patients who can improve their sleep apnea merely by improving their breathing. But, for example, when you take the majority of patients with sleep apnea, so the obese ones, it can't be that simple. They should also at least lose their weight.
Do you know the numbers? Do you know the statistics? How many people suffer from obstructive sleep apnea?
Well, so the first thing to be said is it is repeated throughout different studies that actually the numbers can be underestimated. But still, it is right now, some data shows that up to 30% of the general population is obese. And you can expect that the same proportion of people may suffer from sleep apnea. It is not always, it doesn't overlap 100%. but it gives the idea of what is the extent, the magnitude of the problem. It is also said that men suffer from sleep apnea 2 to 3 times
more often,
yeah, thank you, than women. But it also is related to the obesity.
You said that polysomnography is not that accessible, right? And probably the sleep apnea is underdiagnosed. Yeah. How can we improve that? What could we possibly do?
We have polysomnography, which is the gold standard. It needs to be performed in a sleep lab. It requires specific setting. And then we have polygraphy, which contains less channels than polysomnography. For example, it doesn't take your ECG, or it doesn't take the movement of your eyes. It doesn't take the electrical pulses of your brain, right? So the EEG, it doesn't take it, but it measures the airflow through your nose, the movement of your chest, your belly. So there are less channels, and this kind of appliance, of device, it can be used at home. So it is done in that way that a doctor or other specialist just hands out the device to a person, and the person performs the study, the measurement at home when they're asleep. So it is also more convenient for the patient, because they don't need to sleep with all those cables attached to them in a lab, but they sleep at home. So it's much more comfortable for the patient. And this is the let's say the professional paths. Right now, we may expect that the development of smartphones, of apps, of smart bands, smart watches. So it can actually bring a solution which can be performed by anyone at home, and it actually can give a pretty reasonable notion about the risk of the patient. It's a sign of the future.
This at-home study, how accurate it is? Is it less accurate than full polysomnography? Or is it comparable?
Much less accurate. It gives us less answers about the patient, because it focuses on sleep apnea. There can be other reasons why somebody wakes up at night, right? So it is strictly designed to it is not screening per se, but let's call it screening. It's screen for the sleep apnea, but there still may be some cases which require confirmation with the polysomnography, right? But it still may narrow down the group which needs polysomnography, and some, let's say, some cases may be the polygraphy may be enough, right? So the home appliance will be enough for the diagnosis.
I'm very much interested in topic of using AI, artificial intelligence, in medicine. Do you have any experience or any informations maybe related to that?
No, but I can see an area how artificial intelligence can be used to help diagnose sleep apnea, because so the sleep apnea is diagnosed by measuring the airflow from your nose, from your mouth, to see if the airflow stops in relationship to your heart rhythm, to your movement, to your movement of your breathing muscles, right? So there is a specific pattern of airflow, of moving of your chest, of your heart rhythm, right? So maybe artificial intelligence may help limit. It may help detect a specific pattern, for example, only based on your heart rhythm, right? So maybe it can detect how the pattern changes because of the apnea.
And the pattern of heartbeat can be so unique for sleep apnea that it would be enough to have one channel to
Maybe.
This is just, of course, speculation.
Yeah, this is speculation. There have been some studies which show that, there is a specific pattern, because right after the apnea, your heart rhythm, it rises, right? Because as I've mentioned, the sympathetic branch of the autonomous nervous system is activated, and it means that, the heart will race, right? It will beat faster. And then short after, they may be, the heart rate may slow down. But so maybe artificial intelligence can help us, more precisely devise this specific pattern in relationship to, the normal physiological heart rhythm of this person.
I'm researching myself possibility of using just one channel for sleep apnea detection, and that would be acoustic channel. I'm still on the stage where we design the data collection protocol. Now is the time to design it in the right way. Do you think it would be wise to collect more data, just in case? Not only the acoustic sounds, but maybe heartbeat or something else?
Well, since you are at the stage of the development, right, research, exploration, maybe some other channels might also help. It is reasonable to include the acoustic channel, right? Because, for example, when you suffer from apneas, snoring may happen, right? But it is not always the case. Maybe it will be enough, right? But it's also, again, it's similar principle, right? The pattern of breathing, so of acoustic sounds of breathing changes, right? So maybe they're also more adequate than heart rhythm, but heart rhythm may help.
All the channels, they have different. Not all of them are equally important. So some of them are more important than others. Is that the case? If yes, which are the top 3?
The most important ones for the diagnosis of sleep apnea are those included in this polygraphy, so this home device. So you have airflow through your nose, you have movement of your chest and belly, and you have also oximeter, right? So this little device that is very popular during the pandemic, right? So it takes the oxygen saturation from your blood, and because when you get an apnea, the oxygenation falls down. But oximeter also takes your heart rhythm, right? So that would be the most important channels for diagnosis of sleep apnea.
Thank you so much for your answers. It was a pleasure to meet you and to talk to you. Now I would like to ask you to ask the question for the next guest, but I cannot tell you who that is because I don't know that yet. It can be very general, it can be, I don't know, about life. Imagine you talk to this person on Zoom, for example, and look into the camera.
If you could go to a no-man island, would you really do it?